Transplant surgery and recovery. Your new lung or lungs is implanted by a surgeon by connecting your airway to the airway of the new lung and connecting the pulmonary veins and arteries to ensure good blood flow. You may have an incision across your chest, clamshell, down your chest, a sternotomy, or on your sides, thoracotomies, depending if you receive one or two lungs and your medical history. These details will be described by the surgeon during your consultation as part of your evaluation. The surgery takes about 4 to 6 hours, but sometimes longer, based on your medical and surgical history. You will be put to sleep with medications given in your veins by a physician who specializes in these medications and will monitor you throughout the procedure. You may be placed on a heart-lung bypass machine before your surgeon removes your old lung or lungs, but this is dependent on many medical and surgical factors. Your chest will be opened by the transplant surgeon in the operating room. Your damaged lung or lungs will be removed and new, healthier lungs will be attached. You will have an incision that will be closed with wires, sutures, and/or staples. Your transplant surgeon will explain the procedure in more detail when you meet in person as part of the transplant evaluation. Occasionally, you may need to return to the operating room for bleeding or other complications. You may also return to the intensive care unit with a machine called ECMO, extracorporeal membrane oxygenation, that will give additional support and oxygenation to your body during the recovery period. You may require a tube in your throat called a tracheostomy if you require a prolonged time on the ventilator in order for you to be more comfortable and move out of bed for your recovery. After the surgery, you will be taken to the intensive care unit for close monitoring, usually for 2 to 7 days before moving to a regular room. Your family can come to see you when you return from surgery and can stay at your bedside most of the time, as well as participate in the medical discussions with the team during rounds every day. When you first wake up, you will have a tube in your throat and you will not be able to speak, but the tube will be removed as soon as you are fully awake and able to take deep breaths on your own. You will have other tubes, for example, chest tubes to drain blood from your chest, a catheter in your neck, and a tube to drain urine from your bladder that will gradually be removed as you recover. There will be several medications given to you in your veins, including pain medication. You will not be pain-free, but we will make the pain bearable and you will be able to rest. Many patients will not remember most of their early time in the ICU. Once the breathing tube is removed and you are strong enough to talk and swallow, you will slowly be allowed to eat and drink and will take your medications by mouth. The nurses will be getting you out of bed to a chair within 24 hours and then walking as soon as you are stable, and will be asking you to do deep breathing exercises in order to prevent a lung infection. Most patients remain in the hospital 7 to 14 days after lung transplantation, but sometimes longer. You will have a bronchoscopy, chest x-rays, and/or CT scans to check the condition of your new lungs before you leave the hospital. All members of the transplant team will see you and make sure you're ready for discharge and can take care of yourself at home. A transplant coordinator and transplant pharmacist will teach you and your caregiver all about your new medications before discharge, purpose of medication, how much and when to take each medication, side effects of the medications. Once you're ready to go home, you will be given a schedule telling you when you have your next appointments and testing at UCLA. You will be given instructions on symptoms to call us about that may be signs of surgical complications, organ rejection, or infection. You will have frequent clinic visits at first, but these will decrease as you continue to recover from surgery. You will be asked to monitor your weight, temperature, heart rate, and blood pressure and record this information for review. There is a possibility that you may still require some oxygen following discharge until you recover fully from surgery. Sometimes, Patients require a long time to heal and get stronger. You may be transferred to an inpatient rehabilitation facility to complete your recovery for a period of 1 to several weeks. Our transplant team regularly interacts and guides your care at that facility. You will be transported to UCLA either by ambulance or by a family member for a periodic clinic visit while at the rehabilitation facility. For many patients, full recovery takes several months, but you can begin your normal activities such as bathing, dressing, and walking in the first 1 to 2 weeks following surgery. If your recovery is uncomplicated, you can resume more strenuous activities such as lifting more than 10 pounds, exercising, and driving after 6 weeks. Many patients can return to work or travel within 3 to 6 months after surgery, depending on the type of work or travel destination. Your transplant team will collaborate with you and your family to tailor your recovery to your specific situation. There are potential risks to have lung transplant surgery that you will discuss with your transplant surgeon during your pre-transplant evaluation. Death, failure or rejection of the transplanted lungs, requiring additional medications and possibly mechanical support, ECMO, stroke, seizures, or brain bleeding with potentially permanent brain damage and/or paralysis, kidney dysfunction or failure, requiring long or short-term dialysis. Bleeding and need for additional surgeries to stop the bleeding, risk of disease transmission from blood transfusions, risk of blood clot formation from efforts to stop the bleeding, risks from general anesthesia, lung failure, pneumonia, bleeding in the lungs, or blood clots in the lungs, liver dysfunction or failure, heart injury. Gastrointestinal complications that may require surgery, blood transfusion, or alternate forms of nutrition, prolonged time on the breathing machine requiring a tracheostomy incision in your neck and/or chest tubes. Complications from immobility such as severe weakness, pressure sores, pneumonia, and blood clots. Required lifelong anti-rejection medication, side effects, and complications.